And global affairs analyst Femi Okotobo joins us now to discuss South Africa banning alcohol again as coronavirus surges, just as Sudan lifts ban on alcohol. Good to have you join us, Femi Okotobo. Now, what do you make of the fact that South Africa continues to see a rise in coronavirus cases?
It's a very, very unfortunate situation that South Africa is actually seeing a rise at this time. Obviously, in other parts of the world, you can see that the numbers are going down, although Africa is having a challenge at this time, but even more so South Africa. And, a situation where there are so many cases, almost an average of at least 12,000 cases on a daily basis. Number of cases at the moment stand at, almost 277,000. And the number of deaths is well over 4,000. It is definitely something that calls for urgent action.
So what factors do you think contribute to the fact that South Africa is now the worst hit country in Africa, accounting for about 40% of cases in the continent?
I would say that number one, there's the issue of sensitization. Because I think even generally there's not enough education and enough sensitization about the virus and the way it's actually spread. People have not taken their own health as stably as they should. What you'll also find out as well, that as far as governments are concerned around the world, it's actually a balancing act between lives and livelihood. Now, a lot of governments are under pressure, whether it's from private sector, whether it's from various interest groups, including churches and so on, or mosques, to try and make sure that things return to normalcy. The reality is, at one point, South Africa actually had a restriction on alcohol, which sort of did help in terms of reducing numbers, or probably put things under control. But now, the rise has given to a situation where the numbers are actually increasing, and it's important that obviously to try and make sure that things are brought under control, that such a ban is put in place. And just as was also highlighted as well by the president, the idea is that there's also been a number of motor accidents. There have been a number of alcohol-related trauma cases, and so there's the need to release beds. To make sure that there's actually enough beds to cater for the number of cases that are brought to hospital, especially at a time now where South Africa is actually predicted to reach its peak between July this month and September.
Absolutely. And President Ramaphosa also talked about the fact that the country might see as much as 50,000 deaths. We also know that the district, Gauteng, is the worst hit district, becoming the epicenter of the virus in South Africa, just as we have Lagos in Nigeria. So what can be done for a district like Gauteng?
A lot of responsibility, I believe. Yes, government will do its own bit, but I think individuals are also, also have a major role to play in all of this. And so, any effort in terms of trying to make sure that there's enough sensitization as to how this virus is transmitted. Aside, because you see as little things as people wearing their face mask, if at all they wear it. Sometimes they're wearing it on the chin. You see people who are, probably in public transport, who are not really taking adequate measures. So, as little as these things might be, this is a virus that is so easy to spread. And unless, government and people actually work together towards, controlling the spread, there's bound to be a lot of community transmission.
Right, so I like that you talked about the issues around personal or individual responsibility, because even in Nigeria, we see that a lot of people have relaxed when it comes to social distancing and the use of face masks. So some people say for districts like Gauteng, that is the epicenter for places like Lagos, and some local governments are the epicenter of the virus in these countries. Why not just impose a lockdown and let every other person, move on, since these are the epicenters? Do you agree with such measures?
In the ideal world, and I emphasize on the word ideal world, the idea would have been to have a total lockdown. And perhaps where the epicenters are, I would definitely say that there needs to be a lockdown. But what we also need to look at, on the other hand, is that it is not enough to just have a lockdown. There have to be means, for people to be able to survive, people to be able to actually eat and so on. And like we found out in places like Nigeria or Lagos, when the lockdown was announced, you found out that people actually trooped out on the streets. It now became a source for crime and so on. And people were also agitated as well, because there are not enough social welfare packages in place, for people to actually survive. You also have people who actually, they're daily earners, they earn their wages on a daily basis. And so if you tell them to stay at home, you've not made any provisions as to how they're actually going to survive. They're looking at their child who is crying across the room. It's not going to work. So, and I think that's where the problem actually, lies. But again, social welfare packages are not things that would happen overnight. Yes, you can distribute palliatives, just as we found in places like Lagos and so on. But those are just short-term measures. Obviously, after this pandemic, sort of quits, it's important to try and make sure that even as a country, we need to make sure that we're having proper measures in place that would avoid situations of this sort in the near future.
All right, so let's look at the healthcare workers, because while in that presidential address, President Cyril Ramaphosa did state that while health workers are doing an amazing job, there is still some sort of 12,000 deficits of doctors needed in South Africa. And it's not just for South Africa. And we know that in countries like Nigeria, even in America, doctors or healthcare workers are overstretched. In that kind of situation, what do you think are some measures that can be put in place to curb that deficit, or to control that deficit?
Well, I think maybe one of the things that need to be done, it's natural that for individuals, people tend to, remuneration sometimes is an incentive, apart from having the passion for a particular vocation. So I think it's important that the remunerations that are in place, whether in terms of, for nurses or healthcare workers or doctors and so on, needs to be attractive enough. We shouldn't be having situations where doctors are having to say that they're going on strike because their wages haven't been paid, or because they've been promised allowances that haven't been paid. So that's an area that definitely needs to be addressed and can really make a huge difference. I think also what is also key in all of this is that sometimes, even in that limited situation where there's a limited number of medical personnel, it is also being able to control the number of cases that are having to be referred. And that's why measures like this that have actually tried to, ease up beds, ease up capacity to be able to treat this virus is actually very, very important.
So Lagos is looking at home care, home-based care. Do you think that that's something that everyone or most countries should begin to look at for people or individuals who do not have a severe case of the virus, that they should then resort to home-based care?
I think definitely there's nothing wrong in home care. And if you look at a place like Lagos, for example, where obviously there's limited capacity in terms of number of cases, but thank God that even the cases in Nigeria, especially in terms of what's come to hospital, is actually manageable. Even though I also strongly believe that there are quite a number of unreported cases that are actually going on at the moment. But home care definitely, is extremely important. And don't forget as well that even in other parts of the world, people have also had cases of, coronavirus where they've actually been able to treat themselves at home, even through self-medication. The key thing in here is that different people have different levels of immunity to COVID-19. And so the cases that we should really be having in hospitals should be the extreme cases. And also to make sure that even people, when they're at home, are taking measures to make sure that there's no spread. So again, that's why it's important that even when people are at home, as part of home care, it's also important for people to actually self-isolate. you know, even within families, within households. So there's nothing like, oh, he's my husband or he's my child or whatever. It's important that to prevent the spread, you know, there must be self-isolation. Even in extreme cases, you know, we've had cases where a mother would say, well, I can't leave my child there on, you know, on their own, and especially if it's a young person, and that's very, very understandable. But in such a situation, what should really happen is that even if mother is going to be with child, or whether it's father that is going to be with child, then they've got to make sure that they restrict themselves to that, you know, a particular part of the house, and make sure that they're not mixing with other parts of the family. You'll be surprised that as little, you know, all these little measures will, you know, go a long way in really curbing the spread. And I think this is a message that needs to, not just in South Africa, but even in other parts of Africa.
All right, Global Affairs analyst Femi Okotobo, many thanks for sharing your thoughts with us.